Hello and welcome to our webinar on ultrasound screening for abdominal aortic aneurysm. My name is Jennifer Boniface, and I am one of the registered nurses with the Provider Outreach and Education team. During today's webinar, we're going to focus on the clinical aspects for the Medicare Part B service of ultrasound screening for abdominal aortic aneurysm, commonly known as AAA. Although abdominal aortic aneurysms can develop in anyone, they are more commonly observed in men, especially when they age. Studies indicate that men are at a higher risk due to factors such as smoking and family history, making the condition more prevalent for this group. National Men's Health Week is observed annually during the week leading up to Father's Day. It's a great time to raise awareness about preventive health services, including ultrasound screening for abdominal aortic aneurysm. Our objective for today is to provide an overview of the clinical aspects for the Medicare Preventive Service of ultrasound screening for abdominal aortic aneurysm. And we will discuss background information on abdominal aortic aneurysms, screening for them, treatment options and preventive strategies, and the Medicare Part B coverage criteria for ultrasound screening for abdominal aortic aneurysm. Let's start with some facts and statistics. Abdominal aortic aneurysms are the most common type of aortic aneurysm, accounting for approximately 75% of all cases. They are also 3 to 7 times more prevalent than thoracic aneurysms. This condition primarily affects men, with an estimated 2 to 4% of men aged 65 and 75, or age 65 to 75 rather, being diagnosed. In women over 70 with a history of smoking, the prevalence is around 1%. Annually, ruptured abdominal aortic aneurysms caused 5,000 to 15,000 deaths in the United States, with a rupture mortality rate as high as 81%. And without detection, the rupture rate is fatal in up to 80 to 90% of cases. Even with surgery, the 5-year survival rate after rupture is only 10 to 20%. Screening high-risk individuals, especially men aged 65 to 75, with ultrasound has been shown to reduce abdominal aortic aneurysm-related mortality up to 50%, significantly decreasing the risk of rupture and related complications. So now let's go over some background information. The aorta is the largest artery in the body and plays an essential role in the circulatory system. It carries oxygen-rich blood from the heart and distributes it throughout the body. The portion of the aorta located in the abdomen, just from the spine, is called the abdominal aorta. This section supplies blood to the organs in the abdominal cavity as well as the lower limbs. In some cases, the walls of the abdominal aorta can weaken and begin to bulge outward, forming what is known as the abdominal aortic aneurysm. An abdominal aortic aneurysm is typically diagnosed when the abdominal aorta reaches a diameter of 3 centimeters or greater. For comparison, a normal abdominal aorta is usually about 2 centimeters in diameter. As the aneurysm enlarges, the vessel wall may continue to weaken. In severe cases, the aneurysm can rupture, meaning the blood vessel tears and causes massive and severe internal bleeding. A ruptured abdominal aortic aneurysm is a medical emergency and can be life-threatening if not treated immediately. And a simple way to think about this is like a balloon. As you continue to inflate and deflate a balloon, the walls of the balloon begin to weaken and stretch more and more until finally the balloon bursts if it's overinflated. Less commonly, the aorta can also dissect, which means the layers of its walls start to separate due to the pressure of blood flow. The larger the aneurysm, the higher the risk of it rupturing or dissecting. Most fatalities from abdominal aortic aneurysms are due to rupture, which is why early detection, regular monitoring, and prompt treatment are so critical. Several health conditions can increase the risk of developing an abdominal aortic aneurysm. First, atherosclerosis is strongly linked to abdominal aortic aneurysms, particularly in older adults. This condition occurs when plaque builds up in the artery walls, causing them to narrow. As a result, blood flow is restricted, preventing oxygen-rich blood from reaching the body's organs and tissues effectively. High blood pressure is another key factor, as it can damage the aortic walls, weakening their structures and raising the risk of aneurysm. Additionally, inflammation of the blood vessels, often caused by conditions such as vasculitis, can lead to swelling in the vessel walls, contributing to the formation of an aneurysm. Other pre-existing conditions that increase the risk of an abdominal aortic aneurysm include coronary heart disease, cerebrovascular disease, hypercholesterolemia, history or current presence of other aortic or peripheral aneurysms, pheochromocytoma, peripheral artery disease, chronic obstructive pulmonary disease, kidney conditions such as renal failure, chronic kidney disease, and polycystic kidney disease, and obesity. In addition to these conditions, infections of the aorta caused by bacteria or fungi and physical trauma to the chest or abdomen, such as from car accidents, can damage the aortic wall, further increasing the likelihood of an aneurysm. Certain risk factors can increase a person's likelihood of developing an abdominal aortic aneurysm. The first risk factor is smoking. Smoking is considered the most significant risk factor for this condition. It not only increases the chances of developing an aneurysm, but also accelerates its growth and raises the risk of rupture. Both current and former smokers are significantly more likely to develop an abdominal aortic aneurysm, and the risk increases with the duration and frequency of tobacco use. Smoking weakens the walls of the aorta, making it more susceptible to damage, which in turn increases the likelihood of aortic rupture and dissection. The next risk factor is sex. Men are more likely to develop an abdominal aortic aneurysm. However, women are more at risk for an abdominal aortic aneurysm rupture. The third risk factor is age. The risk of developing this condition increases significantly after age 65. As people age, the walls of their blood vessels naturally lose elasticity and strength, making them more vulnerable to weakening and enlargement. This risk is especially high in older men, with prevalence rising as age increases. Race or ethnicity is the fourth risk factor. Research suggests that non-Hispanic white individuals have a higher risk of developing an abdominal aortic aneurysm compared to individuals of African American, Hispanic, or Asian descent. Family history and genetics are the next risk factors. The likelihood of developing an abdominal aortic aneurysm is higher in individuals with a parent, sibling, or child who has been diagnosed with the condition. According to the National Institutes of Health's National Heart, Lung, and Blood Institute, 1 in 10 people with an abdominal aortic aneurysm have a family history of the condition. For those with a first-degree relative affected by an abdominal aortic aneurysm, such as a parent, sibling, or child, the risk increases to 1 in 5. Abdominal aortic aneurysms can also develop in individuals with certain conditions, such as Marfan syndrome, Louis-Dietz syndrome, Ehlers-Danlos syndrome, Turner syndrome, bicuspid aortic valve disease, and familial thoracic aortic aneurysms. The sixth risk factor is unhealthy diet. A diet high in salt and unhealthy fats can significantly increase the risk of developing an abdominal aortic aneurysm. Consuming excessive amounts of sodium and saturated or trans fats can contribute to high blood pressure, cholesterol imbalances, and the buildup of plaque in the arteries, all which are risk factors for abdominal aortic aneurysms. Over time, these dietary habits can weaken and enlarge the aorta, making it more susceptible to aneurysm formation. The next risk factor is lack of exercise or physical activity. Physical inactivity contributes indirectly to the risk of developing an abdominal aortic aneurysm by increasing the likelihood of obesity, hypertension, dyslipidemia, and impaired glucose control, all which are associated with vascular damage and aneurysm formation. Finally, the last risk factor we will mention today is use of certain drugs or medications. Stimulants such as nicotine can elevate the blood pressure, increasing the likelihood of developing an abdominal aortic aneurysm. The use of fluoroquinolone antibiotics has been linked to higher risk of both aortic aneurysms and dissections, potentially due to their effects on connective tissue and vascular integrity. Abdominal aortic aneurysms can develop gradually over several years, often without any obvious symptoms. In many cases, individuals with this condition remain asymptomatic until the aneurysm ruptures. If symptoms do appear, they may include persistent throbbing or severe pain in the abdomen, back, or flank, pain or discomfort in the pelvic region, groin, or legs, and a pulsing sensation near the umbilical region. Complications include rupture and dissection, both which are life-threatening emergencies. A rupture occurs when the aneurysm bursts, resulting in severe internal bleeding. In contrast, a dissection happens when there is a tear in the inner layer of the aortic wall, which can reduce blood flow to vital organs. Both conditions have high mortality rates and require immediate emergency intervention to increase the chances of survival. Signs and symptoms of a ruptured abdominal aortic aneurysm may include sudden, intense abdominal or back pain, often described as a ripping or tearing sensation, pain radiating to the groin, buttocks, or legs, rapid heart rate, low blood pressure, dizziness or fainting, nausea or vomiting, shortness of breath, cool, clammy skin, and shock. The most common signs and symptoms of a dissecting abdominal aortic aneurysm include sudden severe pain in the abdomen, back, or chest, which may radiate as the dissection progresses, typically described as a tearing or ripping sensation, weakened pulse, and nausea or vomiting. In more severe cases, especially when the dissection impairs blood flow to vital organs, patients may experience fainting, confusion, dizziness, shortness of breath, and sudden weakness or numbness in one part of the body. An abdominal aortic aneurysm can sometimes be detected during a physical exam, particularly if it's large enough to be felt as a pulsating mass. However, most people do not experience symptoms. Many abdominal aortic aneurysms are found by chance during imaging tests performed for other reasons. When evaluating a patient for an abdominal aortic aneurysm, providers usually begin by reviewing the patient's personal and family medical history to check for risk factors such as smoking, high blood pressure, heart or blood vessel problems, or a family history of aneurysms. If risk factors are present or an abdominal aortic aneurysm is suspected, a physical examination may be performed. This typically includes palpating the abdomen to check for rigidity, abnormal masses, or pulsations. Any abdominal discomfort is also assessed, including its location, nature, intensity, and duration. Pulses in the lower extremity are evaluated for the rate, rhythm, and strength, and the abdomen is auscultated to detect abnormal sounds that may indicate turbulent blood flow. Vital signs, including blood pressure, are also measured as part of the assessment. If an abdominal aortic aneurysm is suspected, additional diagnostic tests may be ordered to confirm its presence, determine its size, and guide treatment planning. There are several imaging tests commonly used to detect and evaluate an abdominal aortic aneurysm. The first test is the ultrasound of the abdomen. Abdominal ultrasound is the most frequently used method for diagnosing abdominal aortic aneurysms, especially for screening asymptomatic individuals. The test uses sound waves to create images of the abdominal aorta and evaluate blood flow within the vessels and organs of the abdominal region. Under Medicare guidelines, eligible asymptomatic individuals can receive a screening abdominal ultrasound for early detection of an abdominal aortic aneurysm, with the results interpreted and reviewed by a physician. The next test is the abdominal CT scan. This type of CT scan uses X-ray images to produce detailed pictures of the abdominal organs and blood vessels. It can also help determine the size, shape, and exact location of the abdominal aortic aneurysm. Contrast media may be administered intravenously before the scan to improve the quality of the imaging. The third and final diagnostic imaging test we will cover is the abdominal MRI. The abdominal MRI uses a combination of a strong magnetic field and computer-generated radio waves to provide detailed images of the vessels and organs of the abdominal region. In some cases, contrast media may be administered intravenously prior to the MRI to enhance image clarity. The goal of screening is to identify potential abdominal aortic aneurysms in high-risk individuals early so they can be treated before serious complications occur. The U.S. Preventive Services Task Force, or USPSTF, recommends men aged 65 to 75 with history of smoking undergo a one-time abdominal aortic aneurysm ultrasound even if they do not have any symptoms. Per the USPSTF, abdominal duplex ultrasonography is the primary diagnostic method for detecting abdominal aortic aneurysms due to its high sensitivity and specificity. However, the U.S. Preventive Services Task Force advises providers to consider a patient's comorbid conditions and to avoid recommending screening for individuals who are unlikely to be candidates for surgery or have limited life expectancy. And we'll further clarify the Medicare coverage guidelines for ultrasound for abdominal aortic aneurysm in a little bit. The primary goal of treating an abdominal aortic aneurysm is to prevent rupture, which carries a high risk of mortality. Treatment decisions should take into account the size of the aneurysm, the risk of rupture, and the patient's overall health and surgical risks. As the size of the abdominal aortic aneurysm increases, the risk of rupture also rises. According to the U.S. Preventive Services Task Force, the likelihood of rupture each year for abdominal aortic aneurysms measuring between 3.0 to 3.9 centimeters in diameter is almost 0%. 1% for those measuring from 4.0 to 4.9 centimeters in diameter, and 11% for those measuring between 5.0 and 5.9 centimeters in diameter. There are several treatment options for abdominal aortic aneurysms. The first is medical monitoring. A small abdominal aortic aneurysm typically grows about 0.2 to 0.3 centimeters per year. If the aneurysm grows faster than expected, it may indicate an increased risk of complications. In such cases, more frequent monitoring may be needed to assess changes in or potential risks. Patients with a small abdominal aortic aneurysm can be closely monitored by their healthcare provider for any changes or potential complications. This may include regular follow-up with the healthcare provider and abdominal ultrasounds, usually every 6 months. The other treatment option we will discuss today is surgery. Surgery is generally recommended for an abdominal aortic aneurysm when it is 5.5 centimeters or larger, when it is growing rapidly, meaning at least half a centimeter or more within 6 months, or about 1 centimeter within a year, or when it causes symptoms such as abdominal or back pain, tenderness, or signs that it may be leaking. When planning surgery, factors such as the aneurysm's size and location are considered to determine the most appropriate procedure. The two main types of surgery for repairing abdominal aortic aneurysms are endovascular aneurysm repair and open repair. Endovascular aneurysm repair, also known as EVAR, involves inserting a catheter into the artery through a small incision in the groin. The catheter is then threaded up to the aneurysm, where a stent and graft are placed to help support it. This procedure is considered minimally invasive as only a small incision is required. Open abdominal aortic aneurysm repair, on the other hand, involves removing the damaged section of the aorta and replacing it with a sewn-in graft. This surgery is more invasive than EVAR as it requires a larger incision at the site of the aorta. There are several measures individuals can take to reduce the risk of developing an abdominal aortic aneurysm or to slow the progression of an existing one. The first preventive measure is quitting smoking. Avoid all forms of tobacco, as quitting significantly lowers the risk of developing an abdominal aortic aneurysm. This includes not only quitting smoking or never starting in the first place, but also minimizing exposure to secondhand smoke. Smoking is a major contributor to the formation of abdominal aortic aneurysms. A significant number of related deaths are linked to tobacco use. Chewing tobacco should also be avoided as it negatively impairs vascular health, similar to smoking. Next is maintaining a healthy diet. It's important to eat a well-balanced diet that includes plenty of fruits and vegetables. Additionally, individuals should aim to reduce their intake of high-sodium foods and avoid saturated and trans fats when making food choices. The third preventive measure is staying physically active. It's recommended that adults engage in 150 minutes of moderate intensity physical activity each week, along with incorporating muscle strengthening activities on at least 2 days per week. The fourth preventive measure is managing stress levels. Techniques such as guided imagery, deep breathing exercises, and meditation can help lower stress levels. Socializing and connecting with others can also support emotional well being and contribute to lower stress levels. Another important measure is managing blood pressure and cholesterol levels. Individuals with medical conditions that increase aneurysm risk should take their medications as prescribed to keep these conditions under control and lower the risk of developing an aneurysm. Examples of such medications include blood pressure medications, statins, and low-dose aspirin if recommended by their healthcare provider. Avoiding certain medications and drugs is next. When possible, reduce or avoid drugs associated with increased risk of aortic aneurysms, such as stimulants and certain antibiotics. And finally, getting screened is the last preventive measure we will mention today. Encourage eligible individuals at high risk for developing an abdominal aortic aneurysm to get screened. Medicare Part B covers ultrasound screening for abdominal aortic aneurysm for beneficiaries who meet specific criteria. This includes individuals with a family history of an abdominal aortic aneurysm, as well as men between the ages of 65 and 75 with history of smoking at least 100 cigarettes in their lifetime. As outlined in the Medicare Claims Processing Manual, Chapter 18, Section 110.2, and 42 CFR 410.19, coverage may also extend to other individuals with risk factors identified by the U.S. Preventive Services Task Force as determined through National Coverage Determination process by the Secretary of Health and Human Services. In addition, a referral from a physician, physician assistant, nurse practitioner, or clinical nurse specialist is required for the screening. Finally, the patient must not have previously received an ultrasound screening for abdominal aortic aneurysm through the Medicare program. So before we proceed, I'd like to clarify the current U.S. Preventive Services Task Force recommendations and Medicare coverage for ultrasound screening for abdominal aortic aneurysm, particularly as they relate to women with a history of smoking. Medicare currently covers a one-time ultrasound screening for abdominal aortic aneurysm for men ages 65 to 75 who have smoked at least 100 cigarettes during their lifetime, as well as for individuals with a family history of abdominal aortic aneurysms. This coverage is based on part on the USPSTF's Grade B recommendation for screening men aged 65 to 75 who have ever smoked. A Grade B recommendation means there's a moderate to high certainty that the service provides a moderate to substantial net benefit. Because Medicare Part B covers preventive services that receive a Grade A or Grade B recommendation from the U.S. Preventive Services Task Force, this one-time screening is included as a covered benefit for eligible men. In contrast, the USPSTF recommends against routine abdominal aortic aneurysm screening with ultrasonography in women who have never smoked or do not have a family history of the condition. For women ages 65 to 75 who have a history of smoking, the USPSTF has concluded that there is currently insufficient evidence to determine whether the benefits of screening outweigh the potential risks. As a result, no recommendation for or against screening has been issued for this group. However, it's important to remember that the decision to undergo screening should be based on individual risk factors and made in consultation with a healthcare provider. And you can access the U.S. Preventive Services Task Force recommendation summary for abdominal aortic aneurysm screening on their website, and a link to this summary has been placed on this slide. Medicare Part B covers one ultrasound screening for abdominal aortic aneurysm per beneficiary lifetime, as long as the test is performed by a qualified provider or supplier authorized to deliver covered ultrasound services. There's no copayment, coinsurance, or deductible for this preventive service if the provider or supplier accepts assignment. When performing ultrasound screenings for abdominal aortic aneurysms, proper documentation is essential to avoid issues with Medicare claims. Documentation should include the date the service was provided, a signed and dated physician or qualified non-physician practitioner referral for ultrasound screening for abdominal aortic aneurysm, and any relevant office notes for the date of service. Documentation must also include records of any follow-up care or counseling provided after the procedure, as well as test results and any follow-up care or counseling provided after evaluation of those results. Additionally, all documentation must clearly support the medical necessity of the screening itself. To avoid claim rejections or delays, ensure all records are signed, dated, and include the provider's credentials. Finally, before proceeding with the ultrasound screening for abdominal aortic aneurysm, confirm the patient has met the eligibility and frequency criteria for this preventive service. Accurate documentation is essential to prevent Medicare claims from being rejected or delayed and to ensure proper reimbursement for services rendered. CPT code 76706 is used for billing ultrasound screenings for abdominal aortic aneurysms. This code is defined as an ultrasound for an abdominal aorta performed in real time with image documentation for screening purposes. To qualify for Medicare coverage, the medical necessity for this ultrasound screening must be clearly documented. Typically, this involves indicating both the purpose of the screening and the patient's qualifying risk factors. A screening code such as Z13.6, Encounter for Screening for Cardiovascular Disorders, is used to show the intent of the test. Additionally, a code representing the patient's specific risk factors that qualify them for Medicare coverage based on their medical or family history should be documented. For patients with a history of smoking, appropriate ICD-10 codes may include Z87.891, Personal History of Nicotine Dependence, F17210, Nicotine Dependence, Cigarettes Uncomplicated, F17.211, Nicotine Dependence, Cigarettes in Remission, F17.213, Nicotine Dependence, Cigarettes with Withdrawal, F17218, Nicotine Dependence, Cigarettes with Other Nicotine-Induced Disorders, and F17.219, Nicotine Dependence, Cigarettes with Unspecified Nicotine-Induced Disorders. For those with a relevant family history of an abdominal aortic aneurysm, Z84.89, Family History of Other Specified Conditions, may be used. Additional ICD-10 codes may apply. Ensure both the screening purpose and the patient's risk factors are properly documented and coded to meet Medicare's medical necessity requirements. It is essential that both the appropriate diagnosis codes and clinical criteria are accurately reflected when submitting claims for reimbursement. And you can find additional coding and coverage guidance for ultrasound screening for abdominal aortic aneurysm in the Medicare Claims Processing Manual, Chapter 18, Section 110, as well as in the MLN 006559 Medicare Preventive Services Chart. And links to them can be found on the resources slide at the end of the presentation. For more details on the billing aspects of ultrasound screening for abdominal aortic aneurysm, please refer to the Encore presentation titled Preventive Services, Ultrasound Abdominal Aortic Aneurysm Screening on our YouTube channel. A link to this recording has been provided on the resources slide at the end of the presentation. Ultrasound screening for abdominal aortic aneurysm serves as a key preventive measure for individuals at increased risk of developing this condition. Medicare provides coverage for this screening for Part B beneficiaries who meet specific criteria. So as a recap, during today's webinar, we reviewed background information on abdominal aortic aneurysms, explained screening for them, discussed treatment options and preventive strategies, and reviewed Medicare Part B coverage criteria for ultrasound screening for abdominal aortic aneurysm. This slide contains a few helpful resources for you to review, including links to the ultrasound abdominal aortic aneurysm screening section in the MLN 06559 Medicare Preventive Services chart, Medicare Claims Processing Manual, Chapter 18, Section 110, 42 CFR, Section 410.19, and the billing presentation for ultrasound screening for abdominal aortic aneurysms. Please take a moment to review these resources and feel free to refer back to them as you go through the presentation. The 2026 National Provider Compliance Conference will take place on August 11th and 12th in Charlotte, North Carolina. During this two-day event, experts from the Medicare Administrative Contractors and the Center for Program Integrity will share the latest Medicare guidance, resources, and practical strategies for managing Part A, Part B, home health, hospice, and durable medical equipment claims. To register, click on the link provided on the slides, this link right here. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat. So Mary Sue, do we have any questions in the chat?
Hi, Jennifer. I'm not seeing any questions in the chat at this time.
Please take a moment to complete the survey and share your feedback. We use your feedback to develop topics for future education events. And you can access the survey by either clicking the link in the chat or by visiting the CMS Qualtrics page after the webinar. And that will come as a pop-up and it will look like this with that little yellow triangle. And just so you know, that's not spam, that is actually the way to go to the CMS Qualtrics page. In a few minutes, you will receive an email thanking you for attending, which includes your certificate of achievement and the link to the survey. If you need contact hours for continuing education, they will also be in this email. And if you don't see it, check your spam folder. If you called in, email us at wps.gha.education@wpsic.com with the webinar name and phone number, and we will send you your certificate of achievement. If you think of any additional questions after today's event, you have 7 days from today to submit them. Send them to our education mailbox. Again, that email address is wps.gha.education@wpsic.com, and put the title of this webinar in the subject line. However, if you have claim-specific questions, please direct those questions to our customer service department, as we do not have access to your claim information and are therefore unable to look up claims. Also remember that we cannot accept any type of PHI or PII via email. Finally, on behalf of myself, Mary Sue, and all of Provider Outreach and Education, thank you for attending today's webinar on ultrasound screening for abdominal aortic aneurysm. As a reminder, this presentation will be posted as an encore presentation on the Training Center page on our website. Don't forget, for more information on the billing of ultrasound screening for abdominal aortic aneurysm, please watch the encore presentation of that webinar on our YouTube channel. Remember to take the survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.